Essential tremors are really kind of a diagnostic term for when patients have a predominantly action-based tremor. They're gonna have tremor when the muscles that are having tremor in it are activated. Something like holding a glass, holding a fork, holding a plate. Those are all action-based kind of tremors when I'm physically holding something, and they can be very, very disabling. Essential tremor can actually affect any part of the body. Most commonly, it actually affects kind of the arms, head, and voice, and it usually affects it pretty symmetrically, meaning that if it's gonna affect my right hand, it's gonna affect my left hand pretty symmetrically. But it is important to know that essential tremor as a disease is an entirely different disease than Parkinson's disease. Now, both essential tremor and Parkinson's can cause tremor as a symptom, but the characteristics of that tremor and the aspects of the disease are entirely different. One of the things I often tell and remind patients is they're not life-threatening. And even though they're not life-threatening, they're hugely impactful in quality of life.
Mary always loved to quilt. She made a lot of quilts, and one of the most frustrating times of her life was when she was trying to quilt and her tremors were just getting so bad that she finally had to stop.
And kind of our biggest messaging is saying you don't have to just live with it. We're way too good at treating it, and our goal again is to return that quality of life. And so often the treatment is very different, and kind of our focus points on how we get their symptoms better are slightly different. The starting point of essential tremor is really best understanding the disease itself, kind of how is it impacting the patient? What are the patient's goals and how is this individual tremor impacting their life? And then we start exploring really treatment options. It can often start as simple as using weighted utensils. If those simple kind of what we call behavioral lifestyle treatments aren't good enough, we escalate to medication often because it's the next easiest thing and safest thing to start. If those medicines aren't giving the patient the quality of life they want, it's not good enough to just stop there. We want to really kind of think about additional options. And that's when we get into our comprehensive portfolio of tremor treatment, which includes things like deep brain stimulation surgery or focused ultrasound thalamotomy. And we have a deep part of the brain called the basal ganglia. And I like to think of this part of the brain as the operator system. Unfortunately, with essential tremor itself, we think that that operator system, that deep part of the brain, has kind of static in it. It has this noisiness in it that it shouldn't be there. And it's almost like that big signal leaves, the big part of the brain, goes into the operator system, hits the static, and when it comes out into the hand senses or kind of has that end result of the static. And when we think about treatments, we're really getting to the heart of quieting that static, whether that's with medication or brain therapy. We're really effective at turning down that noise. And when we turn down the noise, it turns down the tremor. What I want to focus on is the person, the human being. And when I do that, it's really easy then to kind of think of all the symptoms that can impact that human. And then as we treat those symptoms, we're treating the person themselves.